Welcome to my YouTube channel. Today I will be discussing a new and important topic, Sjogren syndrome. Sjogren syndrome is an autoimmune disorder that primarily affects the exocrine glands, especially the lacrimal glands and the salivary glands. In this condition, patients commonly experience symptoms like dry mouth and dry eyes. Now coming to the etiology. The exact cause of Sjogren syndrome is still unknown. Several contributing factors have been suggested. These include genetic predisposition, hormonal influence, infectious agents, and immunological factors. Additionally, lymphocytic infiltration lead to the destruction of salivary glands. Some genetic studies have shown that glandular cells express high level of human leukocyte antigen, particularly HLA-DR and HLA-DQ. Next, let's discuss the classification of Sjogren syndrome. Sjogren syndrome is broadly classified into two types, primary and secondary. Primary Sjogren syndrome is characterized by xerostomia, xerophthalmia without the presence of any other autoimmune disease. In secondary Sjogren syndrome, the same symptoms of dry mouth and dry eye are present, but it occurs in association with other autoimmune disease such as rheumatoid arthritis, systemic lupus erythematosus, scleroderma, and primary biliary cirrhosis. Now let's move on to the clinical features of Sjogren syndrome. This condition can occur at any age, but it primarily affects middle-aged women with a female-male ratio approximately 9:1. The most common and characteristic symptoms include xerostomia, that means dry mouth, xerophthalmia, that means dry eyes. The dry eye may lead to itching, burning sensation of eye, sandy feelings in the eye, redness and blurred vision. Furthermore, our discussion will extend to the other systemic manifestations of this condition that include oral manifestations, pulmonary involvement, cutaneous manifestation, cardiac involvement, gastrointestinal symptoms, and neurological manifestations. Now let's discuss the oral manifestations of Sjogren syndrome. Common oral symptoms include cracked lips, angular cheilitis, parotid gland enlargement, halitosis, dental caries, periodontal disease, oral candidiasis, burning sensation in the mouth, dysphagia, and difficulty in speaking. Now moving on to the pulmonary manifestations. Some patients may experience dry cough, pneumonitis, bronchiectasis, hoarseness of the voice. Sjogren syndrome may also present with a range of cutaneous manifestations. The common skin-related issues include dry skin, cutaneous vasculitis, and Raynaud's phenomena. Now let's move on to the cardiac manifestations. Sjogren syndrome can affect the heart, and some patients may experience pericarditis, myocarditis, and pulmonary arterial hypertension. Up next, let's talk about gastrointestinal involvement and neurological manifestations. Gastrointestinal involvement may present with several signs and symptoms, including dysphagia, gastritis, and gastroesophageal reflux disease. Next is neurological manifestations. Sjogren syndrome may affect both central and peripheral nerve system. Some patients may experience peripheral neuropathy, cranial nerve involvement, brain dysfunction, myelopathy. In rare cases, seizure or mood disturbances can also occur. These symptoms show why it is important to diagnose Sjogren syndrome early and give proper care, because the disease can affect many parts of the body, not just the mouth and eyes. Now let's discuss on the investigation procedure of Sjogren syndrome. First and foremost, blood examinations are essential. Following the blood examination, patients with Sjogren syndrome often show an elevated ESR level indicating inflammation, along with mild normochromic normocytic anemia. Next, we move on to the other important investigation procedures, which include xylography, scintigraphy, sonography, Schirmer test for dry eyes, and Rose Bengal dye test to assess eye surface damage. First of all, we discuss xylography. It's a special imaging technique is used to assess any blockage in the salivary gland duct and to measure the amount of saliva flowing into the mouth. One specific radiographic finding seen in patients with Sjogren syndrome is the cherry blossom appearance. This pattern is caused by multiple globular dilatation of the salivary gland ducts. The next diagnostic method is scintigraphy. It is a non-invasive nuclear medicine test that uses a small amount of radioactive tracer to evaluate the function of salivary glands. This helps to detect the abnormalities in glandular uptake and the excretion of saliva. Another useful procedure is sonography. In this technique, ultrasound waves can be used to visualize the structure of the glands. This special imaging technique, salt and pepper appearance, can be seen on the sonographic image. Next is Schirmer test. In case of xerophthalmia, this test can be used to measure the tear production. A small strip of paper is placed inside the lower eyelid and the amount of moisture absorbed after 5 minutes. A result of more than 10 mm is considered normal, while less than 5 mm may indicate Sjogren syndrome. Another diagnostic procedure is Rose Bengal dye test. In this test, a non-toxic dye is placed inside the eye to stain the damaged conjunctival and corneal cells. It helps to evaluate the condition and function of the lacrimal glands. A distinctive color change on staining may suggest the presence of Sjogren syndrome. Next is the management of Sjogren syndrome. The effective management of xerostomia in Sjogren syndrome include the use of artificial saliva substitute, which are available in various forms such as gels, mouth rinse, spray, and specially formulated toothpaste like biotin. These products help to reduce the oral dryness and enhance the patient comfort. Due to hyposalivation, patients experience high risk of dental caries and periodontal disease. Therefore, it is recommended to routine dental checkup every 4 months. Additionally, implementing a topical fluoride regimen and providing nutritional counseling can play a crucial role in minimizing the incidence of caries and periodontal problems. Sugar-free gums and lozenges can help to stimulate salivary flow through mechanical stimulations. Such gum contain xylitol. They have anti-cariogenic activity that help to reduce the risk of dental caries by inhibiting harmful oral bacteria. Patients with Sjogren syndrome are also predisposed to oral candidiasis due to decreased salivary flow. In such cases, topical antifungal agents such as nystatin ointment or appropriate systemic antifungal medications may be prescribed. For the management of xerophthalmia, patient should be advised to use lubricating eye drops or artificial tears regularly to relieve irritation and maintain eye moisture. In more severe cases, the placement of punctal plugs, it's a tiny device that can help to conserve natural tears by slowing or blocking tear drainage, thereby enhancing ocular hydration. These are some of the key strategies for the managing dry mouth and dry eye in patients with Sjogren syndrome. This is a short video presentation to help to understand the condition better. Please watch and subscribe my YouTube channel. Thank you.